Hello, everyone, and welcome back to CR Arthritis. I'm Kelly Lenvoy, VP for Communications and Public Affairs at ACE, and I'm joined today, and I'm very happy to introduce Dr. Alison Clifford, Associate Professor, Division Rheumatology at the University of Alberta. She's interested and focused on vasculitis, particularly giant cell arteritis, a form of vasculitis affecting the large vessels that Dr. Clifford's going to talk to us about. She's an associate member of CanVasc, the Canadian Network for Vasculitis Investigators, and is a lead author and co-author on many research papers. Dr. Clifford also finds time to treat patients at the K Edmonton Clinic's Alberta Rheumatology Unit. Dr. Clifford, welcome to the show.
Thanks so much for having me.
Of course. Now, the workshop that you led was focused on vasculitis and giant cell arteritis, which we'll refer to as GCA in abbreviated form. What aspects were you looking at? And maybe to start off for our audience who might not be familiar with vasculitis and or GCA, maybe just start with some definitions and then tell us just a little bit broadly about the objectives of your presentation and the paper that you are presenting.
Yeah, sure. So giant cell arteritis, or GCA, it's the most common kind of primary vasculitis here in North America. And like you said, it is a disease that affects the largest blood vessels in the body. And we don't know why it starts, but like it sounds, the body starts to attack those big blood vessels and make them very inflamed.
So what was your presentation focused on? I believe it was research work that you had conducted over several years. What was the general focus for that study?
Yeah, so we were looking at PET scans and how they can be used in GCA.
And that's PET?
PET, yes.
Sorry,
exactly.
EET?
No, PET.
PET, okay, yeah, PET scans.
Yes, and PET scans, it's a special kind of imaging test where they put a kind of medicine in the patient's arm, and it can actually be used to see certain processes happening inside the body. So with the kind of PET scan that we were looking at, it is looking at sugar metabolism inside the body. So looking at different places where sugar is being used. And one of the places that uses a lot of sugar is the inflammatory cells. So this special kind of scan lets us see inflammation happening in those big blood vessels because generally they are not accessible to us on exam. They live inside the chest and the belly places, whereas doctors, we can't see them or feel them. So our question, so we know that in patients with GCA, very often they have inflammation of the arteries on their scalp. But also many of them, probably about 70%, have inflammation in these big blood vessels that live inside the body. And we know that this PET scan is very good at showing us those inflamed vessels up front before patients are started on treatment. But what we don't know is whether we can then use that PET scan later on during the treatment course to see if the patient's disease is improving the way that we feel like it is. So that's what we were studying, was looking at. It was a systematic review. So we were looking at what has been published so far to tell us how those PET scans change over time. Do they get better when patients clinically feel better, or do they stay the same?
So before we get into some of those results that you were describing, what were some other methods of detection or scanning besides the PET scans?
Oh, to look for a large vessel inflammation? Yeah, so if you don't do a PET scan, sometimes we can do things like CT scans, or you can do things like MR. MR imaging would be the other ways that people sometimes have it done. Ultrasound can also look at some of the vessels. It can look at the vessels in the head, and it can look at sort of the big blood vessels going to the arms, but it's not going to be able to see the big vessels in the chest and the belly as well, usually.
So an effective way to scan, and as you said, your presentation was looking at the literature, what the research tells us right now in terms of um, how effective is it post diagnosis in terms of being able to monitor, manage disease activity, and what did you find?
So what we found, there aren't a lot of studies, so that's one of the limitations is that there's still probably a lot more work to do in this area.
Mm.
But based on what is out there so far, it seems that most of the time the PET scan does improve when the patients feel better and the doctor also feels like their disease is improving on treatment, um, but they don't always normalize. So they don't go completely back to normal in most of the patients. And that is an area where we still need some more understanding of what this means.
And for people watching or listening today who are living possibly with GCA or are a caretaker of somebody living with GCA or know somebody who's living with GCA, what are sort of the key takeaways? What's uh, the effect or the potential outcomes for patients if we pursue this line of analysis?
I think we need more information still. Um, so we know that this may be a tool that we can use to help follow patients, but it's probably just one piece of information. So it doesn't replace the other things we are doing. Still, I think everyone agrees the most important thing is the assessment between the doctor and the patient, figuring out how the patient feels and how they are coming along. Um, but we probably need some more information, and we maybe need still some better diagnostic tests. Kind of like I mentioned, this medicine that they use to identify the uptake, it's looking at sugar, and sugar metabolism can be affected by a lot of things, not just the giant cell arteritis. So I think some of the questions are, maybe this PET scan isn't as specific as we need it to be. Maybe we still need a better kind of imaging to help follow these patients. Or maybe we need more and bigger studies over a longer period of time to help us try and really get to the bottom of some of these questions.
So, as good research often does, raises very important questions and lines for further study. We're hoping that you're going to be able to join us and keep us informed in terms of where this research is going. If indeed there are new ways to monitor and to scan. So we're looking forward to having you back on the program, and thank you very much for joining us today.
Oh, lovely. Well, it was really a pleasure to be here. Yeah, thank you so much. Be happy to come back.
And thanks to our audience for joining us for another key research highlight from this year's annual meeting. We look forward to sharing more highlights with you in the coming days. And thank you very much for joining us. Bye-bye.